certainly not within the near future.
Yes, sir. We'll bring a microphone down to the gentleman here, and then we'll come back to the back.
Very good, thank you. This question is for Mr. Tony Kay. One of our House members today sent me this document, if you will, Forbes magazine by Mr. Merrill Mitchell. Anyway, last week the upstate delegation was given a litany of the Medicaid expansion through Obamacare and talking about costing it out for the future for South Carolina. And also, Mr. Kay, last summer I talked to Brian Wyatt about our current state debt, which is one of the highest in the country, in case no one realized that. Okay, my question to you is this. Since out of this Forbes magazine article, it says Medicaid spending has been growing at about 8% a year, but Obamacare puts Medicaid on growth hormones. Total Medicare spending, state or federal, is projected to grow from $400 billion to about $900 billion by 2020. Mr. Kay, how can we possibly think that we can afford the amount of spending, whether we cover our part of it and yet cover our state budget for all the projects that we're burgeoning at right now? That's my question. Thank you.
Thanks for that question. I mean, to answer it, I have to take issue with a couple of things Professor Greenwald said. First, look, the tax argument, the taxes are going out of the state is very, very, very overstated, and it's politically advantageous to do it that way. But the reality is there are lots of things that are happening under the Affordable Care Act that we have no control over, and when you look at the effects of that on the uninsured, that means that somewhere upwards of 500,000 people in the state, regardless of whether we take Medicaid expansion or not, are going to get insurance, either through an increase in Medicaid, about 160,000 people, and then the rest through private insurance, through the health insurance exchanges that the federal government will set up. That is tax money that is coming back down to the state. The number of uninsured are projected to reduce by 71%. So this idea that this is an argument between no health insurance for all those uninsured, the 726 to 750,000 that are insured at any one point, uninsured at any one point in time, that's not a valid argument. The projections are there's close to 500,000 people that will be getting insurance, so those tax dollars are going to be coming back. The two main sources of funding, actually, in terms of taxes, are new taxes on high-income earners in the Medicare program, an additional 0.9% on top of what we already pay, and that is coming back to the Medicare program, which there's no changes happening in South Carolina. Everybody still will be participating in Medicare, so that money is coming back. The money for the 500,000 is coming back. And then there's also an additional 3.8% new tax on high-income earners' investment income. That money goes up into the general treasury, and it just disappears. It doesn't say it can be used for health care, or it has to be used for health care. It doesn't say it has to be used for anything. It goes into the black hole of the U.S. Treasury. And the reality is that we are borrowing one of every $2 to pay for health care in the United States right now, at the federal level. We're borrowing one in every two. Now, there's lots of folks who say, well, that's okay. You know, it's okay to borrow it at a higher rate. There's lots of folks who would argue that we should have higher taxes to help pay for that deficit, and I think that's going to happen if you listen to the conversations up in Congress right now to help pay for that. But we are borrowing one in every two. The Medicare trustees, who are made up of President Obama's Health Secretary, Secretary of the Treasury, and Secretary of Labor, plus two at-large trustees, one who happens to be the president of the Urban Institute, another who is an ex-HHS representative. They said that Medicare is insolvent. it does not pass in their latest report, and I didn't bring I actually got it right here, I could read it, but I'll just summarize it for you, that Medicare is insolvent. It is paying out more every year than it takes in, as it has since 2008. And the CMS actuary said, well, I have to dissent from that report. He said it's even worse than that. He says because all these projections that the Affordable Care Act says we're going to reduce Medicare reimbursements, we're going to do all these things, it'll never happen. It's never happened in history. Congress hasn't been able to implement the cuts to Medicare that it made before because it doesn't have the political courage to do it. And so to pretend that it's going to have the political courage going forward to do it just makes, it's just pure political theater. That's the CMS actuary saying that. So, one, all that federal money, and a colleague, a professor of the professors at Harvard, who has written a lot of great stuff about why insurance matters and why Medicaid matters, and it does improve health, is Catherine Baker. And the one thing that Catherine Baker says whenever she talks about the gains that you get from health care, she also talks that legislators and policymakers have to weigh those gains against the benefit, against the cost to get those gains. That never makes it to the interviews. That never makes it to the slides. What makes it to the slides is that, oh, we're all here, and if we just spent the money on health care, everything would go okay. The problem with this table is there's not someone from higher education sitting here. There's not somebody from early childhood education sitting here. There's not somebody from roads sitting here. We have these conversations just among healthcare people like the rest of the world doesn't exist. And so when we talk about can the state afford it, the projected expenditure of the state, the projected additional maximum expenditure to the state by 2020 is an additional $4.3 billion of additional state general funds. Half of that's just growth in the current program, just the current program's growth. And then half of it is the potential of growth through expansion. And so this is real money, that $4 billion. And let's even put a range on it, because we've been presenting ranges while lots of other folks just present this is the exact number. It doesn't work like that. There's a lot of uncertainty in these numbers. But that range of spending is spending that could be spent on other things. Vincent Shaheen this weekend wrote an editorial saying we got to start investing in early childhood education in South Carolina. We got to get serious. Well, where's that money coming from? When I'm sucking up all that money in the Medicaid agency, I'm sucking up every single state general fund dollar next year for Medicaid. My request for Medicaid is more money than the state has available to spend in total. Now you can argue maybe we should raise taxes, maybe we should do other things. But we've got to make choices here. And so it's not a question about do we want to spend, do we not want to improve health. It's a question of where you prioritize to make that spending happen.
Thank you.
I do want to give you the response. Let me get Commissioner just clarify one point though, because I want to make sure I got a question from someone on email. Is regarding the Medicaid expansion that if South Carolina does not accept it, were you saying that those people will still get insured under the federal health exchange? Is that what you were just saying?
No, I'm saying that if we fully expanded under the federal expansion, that potentially up to 500,000 people would come on Medicaid. If we don't accept the expansion, about 160,000 people who are currently eligible today, who aren't part of the expansion, because of lots of different reasons with dynamics of the healthcare law, would come on come into Medicaid. Now, a lot of people would say, well, that's what you should have been doing anyways. And actually, that's what we've been arguing, is that, look, we got to meet our current commitments, and so we've been going out and finding kids who are eligible. Now we're going to go out and find adults who are eligible. But what you can't say is that that doesn't cost us more money.
Okay.
And so let me say one more thing. Out of 500,000, potentially 193,000 of those people drop private insurance to come on Medicaid. So they're not uninsured. So out of that 500,000, up to 193,000 drop private insurance that they already have to come on Medicaid. Now there's lots of arguments that maybe their insurance isn't high quality, or maybe they're spending too much of their income on insurance and can't spend on other things. Those are all fair arguments. But this idea that nobody will have, none of the uninsured will be insured going forward, it's just not accurate. And I think we have to, like Dr. Baker does when she puts her arguments forward, we have to understand the real cost associated with with the improvements in health that will come if you get people covered.
All right, and we're going to come to the back, gentlemen, and then the lady here on the third row, but after Attorney Greenwald responds. But we'll let Attorney Greenwald respond, then we'll come to her.
I'll be very quick about
Go
it.
ahead.
First of all, before every projection, Congressional Budget Office and otherwise says that we will actually reduce the deficit by Affordable Care Act implementation as opposed to if we did not have the Affordable Care Act. It is absolutely cost-effective and better than the current system. The current system, again, when you talk about Medicaid and growth in Medicaid, is the disability care program, not the early intervention program. And it is true, costs will continue to rise if we do not provide people with early access to health care. I think there was also some fuzzy math there. The bottom line is, if South Carolina doesn't expand, the Medicaid expansion is one of the biggest expenditures through the Affordable Care Act. Yes, South Carolina will get its share of funds of things that it has no choice but to do, like the subsidized private health insurance that will be run through federal exchanges. That will come to the state. But on a per capita basis, if you don't do the Medicaid expansion, you will be turning away a large part, close to 50% of the resources that could be coming into this state. So it is not true to say that it does not have that kind of impact on both resources and access to care and dollars into the state. Now also, your math on how much it's going to cost the state, when you just gave that number was assuming 100% enrollment, which never happens. It is completely out of line with any projection, and you also include in those projections the 160,000 people that are already eligible. So on one hand, you say if we don't expand, we'll get the 160,000 in, but on the other hand, the 160,000 you use in your calculations around cost and make it seem like it's part of the Affordable Care Act cost.
No,
so I just
let
have to
me
say,
say, because if we're going to talk about fuzzy math, you were the one who stood up there and said that all the tax dollars would go out of
I'm saying of the Medicaid expansion, tax
you
dollars.
All the tax dollars would go out of the
We were
state.
talking about Medicaid expansion. I started at the beginning to say I am focusing on the Medicaid expansion.
Go ahead and finish your point, Attorney Greenwald, if you finish your point so we can get more questions.
My thought, again, the bottom line is you either take the money or you don't take the money. You don't take the money, there are hundreds of thousands of people.
Let's get some audience questions in, Mr.